This episode is about the changes in the seasons and how it can have an impact on people and their fatigue level, their energy level, as well as their mood. So when you think about it, the fall season can be really complex for families, especially those who have school-aged children, but really anybody. We go from the carefree days of summer to having a typically more structured time. A lot of people are coming off of having vacations, and now they are having to get refocused on some of the things that maybe they put off during the summer so they can enjoy the warm, leisurely days a little bit more. And so this ends up being a drain on your time and your energy. And then also we have darker days. Right now we have daylight savings time, but it's starting to get darker a little bit earlier in the evening and stay dark a little bit longer in the mornings. And once daylight savings time ends, that's going to get even more dramatic for people. So these types of seasonal changes can affect people in different ways. Sometimes there might be mood changes where people feel a little more down than normal, maybe find themselves having some bad days where they just feel kind of blah. So for people that are experiencing that themselves, first of all, I want you to take a minute to assess, is this just a minor mood change that's happening because of the seasons, or are you really having a more dramatic mood change where you need to touch base with somebody in your life to see if they've noticed a difference in your mood, and maybe seek help from your family physician or your primary care provider to have an assessment to see if you have something more serious going on. But if that's not the case and your mood seems to be affected by the change of season, then there's a few things that you can do for yourself. One is to make sure that you are keeping structure to your day, getting up at the same time every day, going to sleep at the same time every day, trying to have good exposure to sunlight, sitting by an open window or going for a walk and getting some fresh air are certainly good things for you to do. Exercise, which is always a recommendation for anything it seems in our society, believe it or not, is a good thing that you can do to help your mood. Socialization is really important with mood changes. Being around other people who can give you energy, and even though it might feel draining at the time, getting out and being with friends can energize you and give you a net gain in the long run. Nutrition is also a good thing to be looking at. A lot of times when our mood is changing, we crave the foods that aren't good for us. A lot of times that might be carbs, it could be alcohol, it could be other things that aren't particularly good for your body or for your mind. So if you're noticing you have some of these mood changes, then focus a little bit more on your nutrition and making sure you're eating a little healthier. Now, if you have someone in your life that's having these mood changes and not yourself, what are the things that you can do to support that person? First of all, you could kindly tell them that you've noticed that they seem to be a little bit down and let them know that you're available to talk if that's something you're able to do. Encouraging them to come along with you, get out to do some things, not isolate. Isolation is something that often comes in hand with mood changes, but it really can work against the person who is isolating. So if you have a friend who you notice is isolating, especially during a seasonal change, reach out to them, let them know you're thinking about them, offer to come by and visit or take them out somewhere. And one of the ways that I help when I work with clients is by helping them discern, are they having a more serious change in mood that maybe needs some medical attention? Or is it something that's a little more mild that maybe we can do some simple techniques to help? If the mood change is more serious and is looking more like it could be depression, then seeking psychotherapy is certainly a good way to go. Cognitive behavior therapy is a modality that I use when I work with clients who are dealing with mood changes along with other things. I also am a big believer in mindfulness. That's probably something people are hearing a lot more about lately, and something that will be the topic of a future episode. And also meditation. A lot of the people I work with ADHD benefit from meditation. When I first discuss this with them, they are a little bit skeptical. They're not sure that they can focus enough to do meditation, but it is something that can be very effective, and I can help them figure out how to get started, how to do it in a way that works for them. And oftentimes, if they follow through with this, they see positive changes in their life. So I'd just like to encourage you to check in with yourself. Think about the changes in the season that we have right now in the fall. how it's impacting you, how it's impacting the people around you, and are there things that you need to do to reach out for help for yourself or someone else. Now, of course, if somebody is having a dramatic change in mood and they are expressing feelings of wanting to hurt themselves or someone else, then that is a situation in which you would want to call 911 and get emergency help. If it's not that serious, having a conversation with them, offering to take them to a doctor's appointment or accompanying them to an appointment if they're going to decide to see a therapist, those are ways that you can be supportive. And if it's for yourself, think about the people in your life who can be supportive of you and who you can turn to get some help so you can get through this difficult time. Thank you and have a great day.